कागज जैसे ये पार्ट बी ये लगा हुआ बी कंपोनेंट तो अगर उसको अप्लाई नहीं मिलेगा तब तक उसको इसमें नहीं वो जो ग्रूविंग होता है वो कौन सा निर्माण लगा है यहाँ पे एक कई ब्रांड का जो चले है सक्सेसफुल नहीं हुआ ऑलरेडी ऐसी चीजें से करते हैं ये नेटवर्क का बड़ा क्या बोली को रेडी आपको जो आपके वो दूसरा ऑप्शन होता है ये हम लोग एक बार वो उसमें क्या है कि जब इसको पाना आटा लगे तो बोलिए नहीं रहेगा खाने का आपको सुबह लगाएंगे सेकंड ऑप्शन होता है ब्लू प्रेशर ब्लू डाउन होता है ब्लू प्रेशर ब्लू अगर देखी जाए तो क्या वो उसको ब्लू वाले तो कंसर्न गैस नानी का तो कम है ना उसको हम चलना है मेरा तो जो प्रैक्टिकल मॉडल तो सबसे बेसिक नीचे ऊपर जाएंगे ना सबसे बेसिक सेकंड बेसिक में क्या होना है और तीन तो इसमें जो आपको किया जाएगा तो सिटी दिया गया है ये हम प्रैक्टिकली लॉन्ग टर्म लॉन्ग टर्म में देखो तो ज्यादा आप उसको बात करते हैं एक्सपेरिमेंटल कुछ नहीं ये जो चीज है ना एक्सपेरिमेंट है वो आपको ये
Hello, can you hear me? Can you hear me? Can you hear me? Am I audible? Am I audible? You can hear me, na? Okay, Reshma says yes. ओके, इट इज 10:28. विल स्टार्ट इन 2 minutes. और कोई लॉग इन हो रहा है? मेरा भी हाफ एन आवर वेबिनार है अभी आधा घंटा. Okay, it is 10:30. Let's begin. So, very good morning to everyone, and thank you for coming on a Sunday morning for this session. So, special thanks to Dipali because she asked me about what commonly comes in the exams. So, I thought probably I should orient you to examinations and, more importantly, ophthalmology. So, we will begin. This is a session. So, today we will discuss a couple of instruments. And if you find this session is useful, I basically think it is very comfortable sitting wherever you are and you can attend. Not everyone can attend a one-to-one session. Today, let's begin with a couple of instruments. So I thought of starting with DCR instruments for today. We will go through the complete detail, complete profile of the instrument, and a few things about the pathology and surgical instruments and steps in surgery. And then you can ask some questions in the chat window, and we will try to answer a couple of them by the end of the session. Okay. So let's begin. So there are a couple of instruments. First, what do we begin with? Okay, let's begin with the most common instrument. Can you see this instrument? Okay. So this is a forcep. If you have to name it, it is a Saint Martin's forcep. It has, let me show you. See, if you see, there is one single tooth to it. Okay, so this is a grasping forcep. So where all you need to grasp the tissues, you can use this forcep. So you can grasp the cornea with it. You can grasp the skin, orbicularis oculi, in DCR, the flaps, any tissue where you need a grip on. You can use this forcep. So where you cannot use is where you need to tie, like suture tying. You cannot use this forcep. You can use it only to grasp tissues. It is a one tooth forcep. Okay, so this is a Saint Martin's forcep. Okay, now next, let's see. Okay, so one thing, it's advisable, whenever I tell you the name of the forcep, we tend to forget the name of the person who invented it. Okay, so this is Saint Martin's forcep. Commonly, we will call it a one tooth forcep or just a forcep. So get used to saying the names. In the exams, it creates a very different impression when you say the name along with the name of the scientist along with the instrument. So you would tend to forget it. You will watch the video again, still you will tend to forget it. So start writing. Writing creates a better and deeper memory track. So even in the chat window now, you can write Saint Martin's forcep. Stmartins. Saint Martin's forcep. So write it once, then you will remember it much better. Okay, Saint Martin's forcep. I will write it for you if you want. Saint Martin's forcep. Okay. So now let's come to the second instrument. What is this? This is a retractor or a cat's paw retractor. Okay, so it has got paws in front like this, like a cat. So that is why it is called a cat's paw retractor. You can see it has got these paws. So you hold like this to retract the tissues away from the site of surgery. So this is exclusively used only for extraocular surgeries. More so, you use it for DCR surgery to retract the wound, to retract the skin and orbicularis muscle, so that you can expose the periosteum and you get a better exposure, you can operate. Okay. So exclusively, most commonly used in DCR surgeries or DCT surgeries, any lacrimal surgery, or also you can use it for orbital surgeries when you're doing deeper dissection and you want to retract the superficial tissues, skin, subcutaneous tissue, fat, all that you want to retract it. There is where you can use this. The point of having these sharp edges is so that it grips the tissue well and you can retract it. Okay, so this is the cat's paw retractor. Everyone write it down in your notebooks or on the chat window so you remember well. Cat's paw retractor. Okay, so this is the second instrument, cat's paw retractor. One more retractor we have, which you should know the difference. Now you see this and this looks alike, except that this does not have a sharp edge. Okay, so this is a Demars Lid Retractor. So this is used in all lid surgeries where you don't want to damage the underlying tissues with these paws. So this is a soft retractor. It is soft on the tissues. Okay, so this is a Demars retractor. Look at the difference. See, this is a Demars retractor. It is smooth. So usually in eyelid surgeries, ptosis surgeries, once you have exposed the skin, orbicularis, underlying fat, and you want to see the LPS muscle, so all the tissues above it come in the way. So there you cannot use this retractor. This will be very sharp on the tissues. So there you use this retractor. This is smoother on the tissues. It does not damage. Okay. So this is Demars Lid Retractor. I'll write it. Demars Lid Retractor. Okay. This is not used in lacrimal surgery, just so that you understand the difference between these two retractors. I have clubbed them together. Okay. This is cat's paw. This is Demars. Now this is another forcep. This forcep is longer, it is straight, and it again has a single tooth. So this is again 1 by 2 tooth. Now this you had previously, this was a corneal forcep. This is much smaller, you see. This is much smaller in size. This is corneal or Saint Martin's. And this is a larger one. This is Adson's forcep, Adsons. Adson's forcep. It is a general surgery instrument. It is not an ophthalmology instrument. So you use it only in extraocular surgeries. Since it is longer, you can go deeper. You can go deeper into the cavities and grasp the tissues. So you can use it in orbital surgeries, you can use it in lacrimal surgeries, DCR surgeries, where you want to go deeper beyond the periosteum, beyond the punched periosteum and the bone, and you want to grasp the mucosa, the nasal mucosa. You want to hold the tissues where this forcep will not reach. This forcep is for fine instruments. This is for thicker instruments like the nasal flap, lacrimal tissue. They are very thick tissues. So you want a much sturdy and thicker forcep to grasp them. Similar in orbital surgeries, you want to go deeper within the orbit and hold tissues or hold masses, tumors. So you want a much sturdy forcep over there. So this is the Adson's forcep. Okay. Adsons. Adson's forcep. Now this is, as you can see, this is a scissor. It is straight. It is straight. So it is a straight scissor, and it is sharp over here. It is sharp. So what are the variations you can get over here? This is a straight scissor. You can have a curved scissor at the tip. Okay. Then this tip is pointed. You can have a blunt. So observe which scissor you are, accordingly name it. Scissor, straight, sharp. So sharp tipped straight scissor. Or you can have a curved blunt scissor. Okay. There is one more which you use in to dissect the subtenons, which is a tenon, which is the Artinotomy scissor. So a tenotomy scissor is mostly, it is curved and it is blunt because you are using to dissect the tenons, subtenons area, and you are very close to the eyeball. So you don't want to poke the eyeball. So it is blunt, and it is curved because you need to follow the curvature of the globe and go on dissecting. Follow the curvature of the globe and dissect the tissues. So there you want a curved and a blunt scissor. So that is a tenotomy scissor. This is not a tenotomy scissor. This is a straight, sharp scissor. Okay. So you use it where you want sharpness, and you don't need a curvature. Like again in lacrimal surgery, once you have taken the incision, what you will see below is the orbicularis oculi. Now you want to dissect the fibers of the orbicularis oculi, which you cannot do with a blunt scissor. You want a sharp scissor, and there is no need of a curvature. You are just going to go and dissect the fibers of orbicularis oculi. So there, this scissor is very useful. You can just go and dissect the fibers like this vertically or horizontally till you reach the periosteum below. Okay. This scissor is also used to cut thick sutures, like anything of diameter below 50 suture. You need this scissor to cut. There you cannot use a conjunctival scissor. Conjunctival scissor is used only to cut the fine sutures, say 10-0, 9-0, 8-0, up to 6-0. You can use that, but for thicker sutures you need a thicker scissor to cut, otherwise you will damage your conjunctival scissor. Okay. So this is a straight, sharp tipped scissor. It's a straight, sharp scissors. Now let's cover this scissor along with it. So this is a conjunctival scissor. It is a spring scissor. Okay, also called as a spring scissor, conjunctival scissor. And you see the tips over here. These are sharp. See this tip? It is sharp. Okay. So what instrument you can confuse it commonly with is a needle holder. It looks the same. It doesn't have a scissor in front. It is not sharp. Okay. So see, see the difference. This is a sharp. It has scissor blades in the front, and this is blunt. It has got clamps in the front to hold the suture. Okay. Look in the side profile also. Look in the front also. This is a scissor. This is a needle holder. Okay. Otherwise, grossly, if you see, they look the same because both are spring instruments. They look the same. Okay. Don't confuse. This is a conjunctival scissor. So this is a multi-purpose scissor. You can use it to cut uh, thinner tissues, conjunctiva, cornea, sutures, all thin sutures you can use to cut this tissue. Okay. Lacrimal flaps, nasal flaps in DCR surgery, you can use this scissor to cut it. Okay. So along with it, let's cover this instrument. This is the needle holder. Now, in ophthalmology, you have two types of needle holder. This is the Barracudas needle holder. Okay, this is the Barracudas needle holder. This is used in all the surgeries that we do. Exclusively, we use the Barracudas needle holder. All intraocular, extraocular surgeries, we use this. Only you have different types of such needle holders you must have seen in the OT. Some of them are fine, some of them are a little bit sturdy, some of them are little more longer than this, some are even smaller than this. So that is a personal surgeon preference. Sometimes you, when you're so taking deeper sutures, you might need a longer needle holder. Sometimes when you are suturing the finer things like the cornea or see like the cornea or few orbicularis muscle fibers or the skin, you need something which is much more small, refined, and a very fine tip. Okay. So there are different types of combinations of needle holders you will see, and it is as you use, you come to know which one best fits your hand. Okay. Like this is a longer one I hold because I need a firmer grip over here. Okay. So this is Barracudas needle holder. You have one more, you must have seen in SICA surgery set. There is another one which is like a triangular needle holder, and it has got a handle over here to slip to hold the needle, right? That is used for superior rectus, taking the whites of superior rectus, or some people also use it for squint surgery. Okay, so that is the NAPS needle holder. Okay, so two of them, keep it in mind, the Barracudas needle holder and NAPS needle holder. These are the two types of needle holders used in ophthalmology. Now, okay, look at this instrument. It is a straight long instrument. Its two ends are little modified. This is sharp over here. It is like a spoon and it is sharp. And here, this is another spoon, but it is curved and it is blunt. Okay, so this is blunt, this is sharp. Let me show you. See, this is the sharp end. Okay, this is sharp and this is blunt. So the name of this instrument is Frey's Periosteum Elevator. So as you know, the periosteum, it is tightly adhered to the bone underlying. So in DCR surgeries or orbital surgeries, you have to elevate the periosteum, dissect the periosteum to reach the bone. So for that, you need something sharp to cut the periosteum at one level. So it's like this is the bone, and you have one more layer of periosteum above it. Now you have to reflect this periosteum to reach the bone. So in order to do that, you need something that will dissect the periosteum. Like you'll have to cut the periosteum at one point. So the periosteum is dissected over there, it is cut, and then you can reflect this flap, you can reflect this flap, and then you can separate these two flaps to reach the underlying bone below. So for that, you need the sharp end. So with this sharp end, you can cut the periosteum like this, and then above it and below it, you can start reflecting. To reflect, you can use the blunt end to reflect it on either sides, and then you can expose the bone underlying. Okay, so this is the phrase periosteum elevator. Write write it somewhere, so otherwise you will forget. Okay, this periosteum elevator is done. Now, yeah, this one very common instrument, BP handle. It is an instrument used to hold the blades in front. Most commonly, we use the 11 and 13, 11 and 15 number blades in DCR and DCT lacrimal surgeries. To fit the blade, you need this instrument. So, as you can see, there is in front here, there is this part that houses the blade, and then there is a long handle. So this also comes in different sizes. This is number 3. Number 3 fits the 11 and 15 number blades on it. Okay. So this is the BP handle. B and P starts for Bard Parker. Again, the name of the scientist who invented it. Bard Parker handle. BP handle. Okay. So this is done. Now this instrument, take a look at it. This is the suction tip, metallic suction tip. Okay, so it has a this is a tube over here that will do the suction from this end. This is the tissue end that you use. The fluids and everything will get sucked from here. This is a chamber which gives you the control. It has a small hole over here. Okay, so this creates the vacuum over here, and this is another tube over here which then connects to the suction machine. Okay, so there is a suction machine. The suction machine will have the vacuum, so this vacuum will go from here to here. Now if you don't close this, there will be no vacuum, there will be no suction. So it is a control for you. Whenever you want the suction to happen, you close it so that you have a vacuum from the tissue to till the machine. So once the vacuum is established, the fluids from here will get sucked. When you don't want to suck any fluids, then you just release this. There will be no suction happening. Okay. So basically, this hole is given. Sometimes you might think, then why? What is the purpose of this hole? You can directly create a direct tube over here and create the suction. So basically, this is there so that you can let the air flow from inside over here. Okay. So once you can, if you tap this, you allow the air to either go or not go. So that prevents the suction tip from getting blocked. Okay, because here you will have your tissues over here. So this gives you a guard so that you can regulate the suction happening from here. Okay, and this is there's a wire inside it. This is for cleaning purposes. Okay, so whenever you mount your instrument, see that you remove this wire and not connect it directly, the tube directly on this. So this is basically there to clean the instruments. Okay, so this is a metallic suction tip. This also comes in different sizes. This is number 3. You get 1, 2, 3, 4. The higher the number, the lesser is the diameter of the, no, higher the number, higher is the diameter of the tube. Sorry. Okay. So this is metallic suction tube. Okay. Again, this will be used. We don't use this suction tube for intraocular surgeries. This is used wherever there is bleeding that is happening, lacrimal surgeries or vital surgeries. That is where you will use the metallic suction tube. Okay. Now, uh, this, as you know, everyone will be knowing this instrument. It has a sharp tip. It's like a pen, and it's long, serrated. It is serrated only for the grip, and it has a sharp tip over here. Okay, so this is just like a pen. So what is this instrument? It is a punctum dilator. You use it to dilate the punctum. Either in the OPD, you use it to do the syringing, or to dilate the punctum and do the syringing. Especially if there's a punctal stenosis, to diagnose if there is a punctal stenosis. To locate the punctum, you can use this. And in lacrimal surgeries, you use it to dilate the punctum. Okay, even in probing and syringing in pediatric patients, when you do probing syringing, you need to dilate the punctum first so that you can probe it. So this is the punctum dilator. So this is named after Nettleship's punctum dilator. So it's very important for you. It kind of bugs the examiners when you don't remember the name of the scientist who invented them. So make an effort to remember the name. In the future, you will also be inventing some instruments and you would want that people remember your name. Littleship's punctum dilator. Along with that comes probe. So this is a lacrimal probe. Okay, it's just like a wire. It has two wires on one side, on each side, and this is in between to grip it. Okay, so you see there are numbers written on it. So this is 000, means this side diameter is 0, this side other side is 00, 000. So it comes as a set of four probes. So there are varying diameters of these wires which are there. So it will be from 40 is the finest one, and number 4 is the thickest one. Okay, and each of them will have two. So 4030, 200, 1, 2, 3, 4. Like these, you'll have four probes together. That's the entire set. So why do you need these different diameters of these probes? Is when you're doing probing and syringing in patients of congenital NLDO, first you want to pass the finest probe through it so that you can locate where the block is. Once you have gone through the block, okay, once that patency is established, then you want to slightly keep on enlarging the size of that track, that hole that you have created. You want to increase the diameter of that tube. So there, then you start using gradually increasing diameters of probes, 40 to 30. I mean, you will just do this. You will use this side and probe it, then you will flip it, then this other side you will use it. So like that, it is used to consecutively drill and increase the diameter of the tube in cases of probing. Okay, and also in when you're doing a normal, otherwise you're doing probing in lacrimal surgeries. So there are different diameters of the lacrimal punctum naturally. So you would need different sizes of probes which will negotiate through that lacrimal, through the apparatus, through the punctum dilate, through the punctum, then to the canaliculus, and then to the lacrimal sac. Okay, and you can also use it when you're doing canalicular tear repairs, when you want to find out the location of the canaliculus. So you probe one end from the eyelid side, and that it will open up somewhere inside in the laceration. So that will give you your inner opening of the canaliculus. Okay, so you can suture the two ends together. So this is basically, it is a probe which you can use it wherever you want to track the canaliculus, the root of the canaliculus, where it is blocked. You can just use this. Okay, so this is named after Bowman's lacrimal probe. Okay, so it comes from 4 to 40 in this range. Okay. Okay. This is an artery forcep. Again, it's a multi-purpose instrument. You use it commonly in painting and draping, or you use it to grasp some tissues during surgery, like when you're doing probably orbital fat excision. Couple of you must have seen it. Orbital fat excision, when you want to grasp the fat, you want to grasp any tissue and then you want to cut it above it, so you can use it. You can use the tissue to grasp it. Or you are doing any lacrimal surgeries or canthal surgeries, you want to grasp the tissues over there, there you can use it. So this is an artery forcep. Okay, so a smaller version of this which comes, that's a mosquito forcep. You must be aware about it. So this is a straight artery forcep, and the smaller one which is curved in the front as an artery, that's a mosquito forcep. Even in squint surgeries, use the mosquito, the straight mosquito, to hold the tissues, hold the muscles. Okay, now let's come to this instrument. What is this? This is a bone punch. Okay, so you use it in lacrimal surgeries, DCR surgeries, to punch the bone. Okay, so you grasp it like this. If you punch it, when you punch it, you see this arm and this arm, they move closer to each other, and then you grasp the bone in between it. Let's say this. You might just grasp it in between it and cut it. Okay, so this is a bone punch, named after whom? Garrison's bone punch. Okay, Garrison's bone punch. So this also comes in different sizes. This one is, see, let me show you the tip. See, so you engage this part behind the bone and you engage this part in front of the bone. So the bone comes in between these two, and when you take them together, it cuts it. And you release it, you remove the bone bits which are cut in between, and you again punch it. Okay, so you're going to punch the bone to create a bony ostium while doing DCR surgeries. Okay, so this is Edison's bone punch. Okay, so this, the smallest size that comes in it is 1.5. So you see this is 1.5. This is very fine. So you use a smaller punch when you want to take the initial punches. When you have reached the bone, you perforate the lamella papyracea, which is the ethmoidal bone, and you have a very small window over there. So that time you start with this smaller punch because there's not much space over there to punch the bone. So once you have done a couple of punches with this, then there is some hole which is created opening over there. Then you have some space to pass these bigger punches over there. Okay, then you start punching with these bigger instruments till you reach the desired size of the ostium. Okay, so this is Garrison's bone punch. Okay, so all the instruments for DCR are over. So what do you want? You want me to name all of them again, or what do we do? You have any questions? You can put them in the chat window. If you have any questions, you can put them in the chat window. So we will answer if you have any. Okay, while you put the questions, let me just say one thing I wanted to tell you. See, this is the needle holder. So the way you hold the instrument is very important. See, this is the needle holder. You should grasp it from these two sides like the way you are holding a pen. Okay, and then take the suture bite and hold this. Okay, don't hold it like this. You can't operate. How do you have to you have to operate both arms of the needle holder. So you can't do like this, or you can't do like this. You can't do like this. Okay, this arm has to be free. It has a spring action, so it has to be free so that it can act. So hold it below. Let this arm go above your hand. Hold it below and then operate. Okay, don't put your hand above it and operate. You can't operate it. Okay, so hold it like a pen and like this. So you have enough space to maneuver. Okay, similarly for a scissor. In the scissor, if you cut like this, you will go up and down like this in cutting where you want to cut. Okay, your hand will not be stable. So use your index finger on the tip and put your first and third, these two fingers through this, and use your index finger on top of it where the blades cross each other, and this gives you stability. See, this gives you stability. You can push it and then you can grip it over here and then cut. It's much more stable. Okay. Okay, so Dipali is asking, Sitili bone punch, how is it different? Which one do you have a image of Sitili bone punch? Sitili bone punch. No, Sitili bone punch, basically, see, what I see the difference with this is when in Sitili bone punch, na, this part is bigger than this part. It protrudes much beyond this part. So here they are in alignment. See, this is in perfect line over here. In a Sitili bone punch, this part would protrude above. It would be like this. So when you come closer, this one will override the part over here. That's the only design difference between a Sitili bone punch and this bone punch. Apart from that, I don't see any difference in both of them. Yeah, that's the only difference with Sitili, and they just have one more additional size in it. Apart from 2 and 2.5, it has one more. So this Garrison's one comes in 1.5 to 2.53 commonly, and this Italy has an additional 1.5 to 2.2, 2.53. So they have one more additional one, and this thing overrides over here. We have been commonly using the Garrison's bone punch. Okay, Dipali? Yeah. Do we have any other questions? What was I talking about? Grasping the instruments, right? Same goes with the scissor as well. Okay, you hold it like a pen. Don't hold it like this. You won't be able, you don't have enough space to cut. This instrument, holding it like this, allows you to be in the plane of the surgery while cutting. So you can go even deeper with this. You can stay horizontal, you can go upwards. You have enough sway to operate. Once the spring arm is above your hand, you have enough sway over the instrument. The instrument has enough space to move in your hands. Okay, so hold all your instruments like a pen. Even the forceps, hold them like a pen. Don't hold them too behind, you will not be able to use the spring. Don't hold them too close, you will lose the entire spring action. The spring action is from this end till this joint over here. Till this is the entire length of spring action. So if you hold it behind over here, you will not be able to use the spring action effectively. You hold it too close, again you have missed this much amount of spring action of the instrument. You can't grasp and you will again come very close to the tissues. So hold it in between. See, these 2 points, these two uh, marks are there. Hold them in between so that you have sufficient grip of the instrument to hold. Okay, fine. So do we have any other questions? So today we have covered the lacrimal instruments. If this works for you, if this format of teaching and learning works for you, probably we can have more sessions, quick sessions of instruments, maybe the lid instruments, orbit instruments, intraocular surgery instruments, glaucoma surgery, corneal surgery, all those instruments quickly, half hour sessions probably, and then we can just complete the instrument sessions and move on to next sections of ophthalmology. ठीक है? So just let me know how this session went for you so we can plan future sessions for you. Okay? Sure. Thank you.